Okay, so now we're going to talk about kinesiotaping. There's a lot of different kinds of taping that you can do. For rotator cuff tendonitis and things like that, or just general shoulder pain, there's a taping that I like to do that I'm going to demonstrate to you, and it is in your packet. So first thing I like to do before I tape somebody is that I'm going to use an alcohol wipe to clean the skin. Not to say that Katie's skin is dirty.
You're giving me goosebumps.
Sorry, but you know, otherwise it won't stick very well, okay? So you want to kind of just clean off the skin, right? And that'll help it stick longer. It usually will stick like 2 or 3 days is what I tell people. Tape can get wet. It's just that once it gets wet, it starts to not stick very well. All right, so then you're gonna measure. Usually you go insertion of deltoid as your base for your tape, and then you go up like this and a little bit past the joint. So you're gonna measure how much tape you need. And there's 2 pieces of tape. Okay, so this is the first one. This is deltoid. And so what I'm gonna do is, this is what they call a Y cut. I don't know, it looks more like a V to me, but anyway. So we're gonna do a Y cut on the deltoid. And so I'm gonna lay it down like this with no tension, okay? Just lay down the base, and then I'm gonna put a little bit of tension and grab it by the tails, and then kind of turn it around and put it on either side of deltoid. Now, I'm gonna make this look easy because I've been doing this for a long time, but it is actually kind of hard. And I would recommend that you don't have the shirt in a way if possible. If you can get their shoulder outside of the shirt, that would be best, okay? Because it is kind of a thing to go around the shirt. All right, so this is your deltoid piece. And then what I'm gonna do next is do a supraspinatus piece. So you're basically just reinforcing these muscles that are being really taxed when you have a shoulder issue, or maybe they've been injured or something like that. For supraspinatus, I actually like to do a solid piece. So if you find the spine of the scapula and you go just superior to that, that's where supraspinatus is. So it's going to be right in this area. And so I'm going to kind of measure that and do just a solid piece for supraspinatus. You can split it. I think your handout actually does say to split it. Okay, so I'll show you the split, but keep in mind that you could actually use a solid piece, okay? So I've got the base again, same thing, Y cut. I'm going to actually do the base on insertion of supraspinatus, which is gonna be right over middle deltoid, okay? So goes right over middle deltoid, and then you're gonna bring it up. You're gonna bring the tails up, and this is like where the challenge comes in. You have to get under the shirt. So again, when you tape your person, I would ask them, or you know, hopefully you all are gonna dress in layers like I asked you to when you come to lab, because then you can just remove some of your layers and it'll be easier to tape each other, okay? So please do that. So now I've got the other tail, and I'm bringing it through here, okay? And I'm gonna lay down the ends with no tension, okay? It's really important to lay down the ends of the kinesio tape with no tension, otherwise they're gonna peel right off. And then rub it to activate the glute. I don't know if that really works, but that's what they say in the class, so whatever. Okay, so that is how you tape, and it kind of looks like this when you are done. And then that's gonna really be pain relieving for your shoulder patient. And so I do that before I make them do exercises and stuff so that they'll be more cooperative with doing exercises.